Optical illusions, what are they? Before we can answer this question, we have to know how we see in the first place. Sight, which is basically light, is a perception of reality which we think is true. But what you're actually seeing is reflected light waves flipped upside down, reversed, then converted into electrical impulses, reinterpreted, then finally projected as visual conscience. This whole process takes a little less than a tenth of a second. Now, that delay is really long, way too long. So, to close the gap and to make all its processing duties easier, your brain makes predictions about where things in your vision will be, and sometimes it just makes things up all on its own. That's where optical illusions come in. Optical illusions are basically interrupting your eye-to-brain connection by predicting where your brain is likely to mess up and send you false information. There are basically three types of optical illusions: literal, psychological, and cognitive. A literal illusion is the simplest out of the three. At first glance, a picture will look like one thing, but when your eyes adjust to all the details, the picture will become of something else. This is because of one of the ways to fill the tenth of a second delay is by filling in details based on pattern recognition. This picture has enough patterns that your brain initially reads it as something else, which takes its energy of processing every shape, color, and angle. Literal illusions work by fooling your brain for a moment before all the details settle in. The next type, called a physiological illusion, is more complex. It's not based on your brain's mistakes, but the limitations of your retina. To be more specific, it's believed to be based on something called lateral inhibition. The photoreceptors, light-receiving neurons in your eye, are arranged in rows. When one of them is stimulated by light, the surrounding neurons are inhibited and respond less strongly. Your eye decides to filter out a lot of the light noise, keeping the most dominant neurons brightly lit and creating contrast with less dominant light sources. In the Hermann grid, at the intersections, your receptors are flooded with white light from four sides. This creates a lot of lateral inhibition, and the receptors in those areas respond less strongly, making the intersections appear darker. But if you look directly at one of the intersections, the gray disappears. This is because the center of your vision has a significantly higher concentration of photoreceptors and creates a clearer picture than anywhere else in your eye. The last type of optical illusions are cognitive illusions. These take place far away from either your eye or the visual processing center of your brain. These illusions happen in your understanding of an image itself and your existing knowledge. The key is to have an image that doesn't make any sense while having no actual flaws. Your brain doesn't know what to do with the conflicting information, so it accepts an inconsistent image.
Leave me with some